Okay, welcome everyone to Cannabis Public School. Thanks for being here. About Cannabis Public School, our mission is to ensure that everyone across America has accurate information about the holistic benefits and the potential risks of cannabis. We advocate for increasing acceptance among cannabis therapeutics among conventional healthcare providers, which is a continuous act that enables healthcare consumers to feel they're supported in their decisions on how they take care of their own health. We embrace the spiritual and recreational value of cannabis. We are at the dad joke of cannabis, this portion of Cannabis Public School. And since I grew up in New York, I have a New York Jets joke. What's the difference between a Jets fan and a baby? The baby will stop whining after a while. I guess the Jets fan had a reputation of being kind of whiny. Hey, we're excited to have Megan Bang back at Cannabis Public School for a third time. And we're excited for the material she's presenting today. We're also happy to meet former NFL player, Green Bay Packer Hall of Famer, and Super Bowl champion, Gilbert the Gravedigger Brown here. Megan and Gilbert met on a podcast last year, and they'll share Gilbert's healing journey and how they came to create Thrive and Thrive XL. Megan is a BSN RN with other credentials behind that. She is the revolutionary force behind Trusted Canna Nurse. Recognizing a gap in the healthcare system, Megan set out to bridge the divide between patients and the world of cannabis, CBD, and psychedelics. Megan holds a Master's of Science degree in medical cannabis therapeutics and thrives in creating content that breaks down complex ideas that is both educational and entertaining. Please follow Trusted Canna Nurse on your socials if you don't already. In addition to cannabis and psychedelic education and guidance, the Trusted Canna Nurse developed an entire therapeutic line of hemp products, including tinctures, topicals, edibles, and even suppositories. Megan.
Yeah.
Take us down that rabbit hole.
Let's go down this rabbit hole.
I'm going to stop my share. You're going to start your share.
Fine. Okay. How's this look? Can you see?
I can see.
All
yes.
Right. Okay. All right. I'm nervous. Whew. All right. I'm so glad to be back for a third time, this time talking about the science of cannabis and concussions and concussion recovery. There's a lot of science. I'm going to try to break it down in a way that you guys can understand and, pick out the important parts of the science of cannabis and concussions. I'm going to start sharing my son's story, go into the science of it, and then we'll talk to Gilbert towards the end and he will share his story. So a little bit about us, about Trusted Canna Nurse, other than what Mo wonderfully said, we are a team of medical professionals. We have a pharmacist, we have a few nurses, and we empower people to heal with both cannabis and psychedelics. We help people who are just starting their journey, and then we help people who are on the other spectrum with problematic use, kind of decrease their use and improve their relationship. We help chronic illness, cancer, pediatrics, and adults. And then we have microdosing programs for those interested in microdosing psilocybin and learning how that works. We also have our full line of hemp products. We're inviting you guys today. If you feel called, you can use the code THRIVE for 20% off. Okay, so we're going to start with my son's story. My son was 8 years old. He is 8 years old. His first injury happened back in January of this year. On a Sunday afternoon, he was playing soccer. He was standing on this 4-foot wall. He managed to fall backwards and face plant on the concrete. And then he got himself a nice goose egg pictured here. He had the symptoms that afternoon. He was so sleepy. He had fatigue, confusion, all the symptoms. But then he started to get better. We didn't feel we needed to like take him to the ER or anything. But then 2 days later, he was playing soccer at school, and he should not have been playing soccer, but he was. And then he fell again. Fortunately, it was just in grass, but he fell and hit that same side of his head in the grass. And he started having like worsening vision, is what he told me. So we took him to the ER, had a CT scan to rule out a bleed. Because if you know anything about concussions, it's that second hit before the first one has healed that can be really detrimental. So what we did is we started him on Thrive XL, our most potent formulation, has CBD, CBG, CBDA, CBGA, and beta-caryophyllene. We started him on that. We did 3/4 of a dropper in a capsule. He doesn't like the taste. This taste is pretty strong, so he swallowed a capsule 4 times a day, and that was about 300 milligrams of cannabinoids total per day for the first couple of days. And then as his symptoms started resolving, then we slowly weaned him down. He was on like a maintenance 1 capsule a day for like maybe a week or 2. He was symptom-free the following Monday and then back playing soccer the following Wednesday, and has not had any concussion symptoms since then. So he's not on any CBD right now unless he like hits his head again, then we'll give him a dose or 2. And during the time of his healing, he would ask for his CBD, saying it helped, it makes my brain feel like normal. Okay, let's get into the science of what happens in the brain. Why is my screen frozen? There we go. Okay, well, first, before we do that, why is it important that we learn how to recover from concussions? So those with head injury have a 24% increased risk of developing dementia. A lot of that is because of the neuroinflammation that we're going to get into. We can develop sensory motor dysfunction, psychiatric disorders, anxiety and depression are huge parts of concussion and concussion recovery. CTE, this is what we see in really severe, severe cases with NFL players who had many, many concussions during their time on the field. And there currently are no FDA-approved pharmaceuticals for concussions. So now the science of what actually happens in the brain. So we were kind of taught that like a concussion is like this coup contra coup action where the brain is like hitting the skull and there's bruising. That's not actually what's happening in the brain. So we have white matter and gray matter in the brain, and those are 2 different densities. And I like to think of that as like you have like Jello and pudding on top of each other, 2 different densities. So when that's in motion and all of a sudden it comes to stop, those are going to stop at different rates. And that's going to cause some stretching between those 2 areas. And that causes stretching of the neurons. And when this happens, it's going to cause all of these neurons to fire all at once. And that's why people see stars, they get dizzy, they black out immediately after a concussion, is because these neurons are stretching. I like to think of it like a silicone straw that has tons and tons of tiny little holes in it. You stretch that silicone straw, and then, water can leak out, air can leak in. There's this exchange of ions, and that's what causes these neurons to fire. And you have millions or billions of them firing all at once. all of this glutamate, and then that's why people are seeing stars. That's the first phase of a concussion called the excitatory phase. Following that, then we have phase 2, which is called spreading depolarization. Buckle up, this is the sciencey part. So all of that glutamate that's now flooding the brain causes calcium to go into the neuron. And that calcium it's like, I guess it's really sticky, and it sticks to the mitochondria, or it prevents the mitochondria from producing the energy that the brain needs. So we have this energy mismatch in the brain. And it takes about 2 to 4 weeks for that to balance out in most people. And I think the statistic is 70% of people will recover from a concussion within a month, and then 30% will have symptoms for months or even years out. And typical symptoms: nausea, headache, the brain fog, fatigue, sleep disturbance. My son had all of these. We were trying to do his math homework in the days following his concussion, and he was 8 years old, and he could not count how many fingers I was holding up. And as a mom, that's like a really scary thing. But now looking back, it's like, okay, this is what was happening in his brain, this energy mismatch. So following all of this, there's a release of pro-inflammatory cytokines. And cytokines are these little proteins, and we have anti-inflammatory cytokines and pro-inflammatory cytokines, and they can kind of be like the brakes or the gas on our immune response. And the pro-inflammatory cytokines that we have are TNF-alpha, IL-6, and IL-1B. And these are kind of gas pedals on our immune response. We also see an accumulation of lactate, increase in oxidative stress, and free radicals. Free radicals are these little molecules that bounce around and cause tissue damage in the brain. There's impaired blood flow to the brain, and then there's brain swelling or cerebral edema. Then there's the psychological component: the anxiety, the depression, the isolation. Kids can't go do their sport. They can't move their body that makes them feel good. And then, there's the isolation. They can't see their friends. So that's a huge part of this. And then there's also a neck injury component. There's rarely a concussion that doesn't come with a side of some degree of neck injury. All right, neuroinflammation in the brain. So not all neuroinflammation is bad. We actually need some degree of neuroinflammation, like a low level for our immune surveillance and development, memory, learning, tissue repair, neuroprotection. It's the high levels and the chronic levels that we worry about. And that's when we see the neurodegeneration and damage and anxiety and depression. And again, it's the IL-1, the IL-6, the TNF-alpha that we are concerned about. Those are the pro-inflammatory cytokines. So we see these specific cytokines elevated in concussions, in dementia and Alzheimer's, in long COVID. And I'm sure that there are many other, chronic inflammatory states where these specific cytokines are elevated. So no pharmaceuticals. However, cue cannabis and cannabinoids. We do have some research, it's in vivo right now, but we have some research showing that CBD, CBG, the combo of CBD and THC can suppress these specific cytokines: TNF-alpha, IL-1B, and IL-6. However, THC alone does not suppress those cytokines. And then all of our favorite cannabinoids also act as antioxidants, gobbling up those free radicals that are bouncing around and causing that tissue damage. We know that CBD and CBG can regulate cerebral blood flow and enhance neurogenesis. Interestingly, psilocybin also suppresses the exact same cytokines, which is likely why we see psilocybin helping people with their chronic pain issues. And I'm excited to see when we can see psilocybin in concussion recovery. I think that's going to be in a decade or two, I believe. All right, I love this graph. Let me orient you to this graph a little bit. This is like the weight of the evidence that we have on cannabinoids and inflammatory cytokines. So the red is CBD, the green is CBG, the tan is THC, and then the gray is CBD plus THC. So we see that that CBD in the red decreases the pro-inflammatory cytokines, TNF-alpha, IL-6, IL-1. There's a lot of evidence showing that CBD can decrease those pro-inflammatory cytokines. Some evidence that CBD and THC does, some evidence that CBG does. If you look to the right, upper right is where we see an increase in pro-inflammatory cytokines. An increase in those exact same cytokines that are problematic and that cause symptoms in concussions, we see an increase in those with THC alone. So just let that sit in. If THC is the only cannabinoid that you're using, maybe we should add in some CBD so that we're not increasing our pro-inflammatory cytokines. And again, this is in vivo, so we don't have human studies to prove this. However, I see people who are using THC alone. They are still having lots of pain, and they're still in. Some people are still in a pro-inflammatory state if they are using high doses of THC alone. And then we also see on the bottom our anti-inflammatory cytokines. Those, CBD can decrease some of those. So I love this graph. This just kind of puts into perspective like the action of the different cannabinoids on the cytokines. I don't think we have any information yet on the acids. Can't wait till we have that in the future. Human research. We have a few trials, not many though. Number one, this trial, they took, I believe it was 20 soccer players. They had them head a ball 20 times to induce a subconcussive state. So if you look at the graph here, the NPC is the first thing that they're looking at, near point convergence. This is if you take your finger and you put it in front of your face and you bring it closer to you, when that turns into two images, that distance there, that's what they're measuring. So when you have a head injury, that distance increases. So they were measuring that distance, everybody started the same, and then everybody kind of went up the same distance. However, the cannabis users, their distance stayed about the same after, 2 hours post, 24 hours, and 3 days. But the non-cannabis users, that distance kept getting further and further away. They also measured astrocyte activation. The cannabis users, their astrocyte activation, that's a measure of neuroinflammation that we can actually measure in humans. Their levels started low and stayed low, and the cannabis users, their levels kind of, as you can see, went high and kept going high. There was another study done, 2019, that showed that they compared concussion recovery with but in people who use cannabis, nicotine, and alcohol. And they found that cannabis use was associated with lower symptom severity in the 3-week mark post-injury. This interesting study was done. I was only able to get my hands on the abstract. I would love to sink my teeth into it. They found that CBD use was associated with worsening concussion symptom scores than non-users. So, which was really curious to me because the science doesn't really make sense, but these are the only human studies I could find. The NFL is, I'm excited to see what the NFL puts out because they are studying. Okay, so now I'm going to pass the ball to Gilbert. Here are his stats here. I will let you read, and we'll just kind of do like back and forth Q&A with me and Gilbert. And so we met on a podcast last year, and Gilbert, why don't you share with us like what your symptoms were? Had you ever used cannabis or CBD? And and kind of what we did.
You're just gonna let me talk now.
I'm gonna let you talk.
Okay. I mean, I never touched marijuana or anything. I was one of those rarities that was very clean when it comes to drugs. My mama would have killed me if I'd have took anything. And I'm a mama's boy, so I did what she told me to do. She still give me spankings today, so it don't. It's just one of those things where, it was kind of hard to, try or trust anything. We ain't never done anything with it, So when I was talking to Megan about it on our podcast, You know, she said, give me a try. And another reason why I tried it is because I said, well, I ain't got to take no more drug tests anymore or anything like that. So let's go on and try it, you know? So even though I'm sure we'd pass anything by taking this stuff, but the properties of it was surprising to me. I'm a big man, so I told Megan that I probably need a higher dosage because I'm not your average size human, you know. So I took the stuff, and what was amazing about it is that you know, I do a lot of driving from Detroit to Wisconsin, and my my joints used to swell a lot. My joints used to swell a lot. Uh, and going back to what Megan was talking about with concussions, you got to remember back when I played, that was a stinger or a just take 2 plays off and get back in there. You know, it's not like that what they're telling the kids now, which is a week protocol. We only had like 15 minutes and we had to get back out there, you know. So our stuff is totally different from how it is now. So when you add all that up and you take a product like this and you see brain fog lifting a little bit, you know, as time goes on. You know, I mean, I'm in a car with my son and I go around a roundabout 2 times. And like, Dad, what you doing? I'm like, oh, I'm just seeing if you was paying attention, you know. But and the crazy part about it is that some of my teammates, I have gave them samples, and each one I gave samples to has signed up to get more. Um, you know, it speaks for itself, you know, and they're putting their brothers and sisters and mamas and, you know, because my mama has carpal tunnel, you know, all these properties that has to do with the body, and people got to understand it's not an overnight success. It takes time to get in your body, you know, and that's what
How
I
long
tell
did
her.
it take you? How long did it
Uh,
take? How long did it take you before you started feeling differences, and what were the differences that you felt?
I'm gonna say it took about a week and a half, 2 weeks. Um, to be honest with you, you know, as far as being able to pinpoint things better than what I was doing before, you know. I got a lot of stuff I got going on. I got a lot of scheduling, and sometimes I forget things. And sometimes I forget to write things down, you know, and sometimes you know, my pain and different things like that, the swelling, I don't have no kind of swelling like I used to have. When I get out the car, I look like I got tree trunks on the bottom of my ankles, you know. But now when I get out the car, I got beautiful ankles, you know. I don't got cankles, you know. So it's just like it's just one of those things where I really believe in this product because I didn't when I first started. I was, let me try it, let me see what it's gonna do. But now, I mean, for all its properties that it's helping me with in different areas, you know, I believe in it real well. And I mean, I'm not a fan of the taste, not at all. Mm-mm. But like I say, it's one of those things where if you give it a try, you know, and Megan makes some capsules up for me. I'm just like her little baby, I guess. You know, I can't do it, you know. But it's awesome product, and I ain't got no reason to lie to anybody. You know, it's just one of those things where it's helping me, so I want to help my people. I want to help my mama with her carpal tunnel. I want to help my friends try to get better out of this brain fog, you know, and a lot of guys are taking this because of the way it's making them feel. You know, I mean, you play my game. I played for about 11 years. It's like you got 200-300 pounders running at each other, and you hitting a wall. Then you got to get up in the morning, um, and 10 years later, and think you're gonna just pop out of bed. It doesn't work that way. You know, your body is trying to do things that, you know, your mind is telling you you can't do or you can't do. So I'm really thankful that Megan gave me this opportunity and this product, because it's a life changer. It is. It's a life changer, and for people with chronic pain and chronic brain fog, you'll understand what I'm talking about.
All right. Thank you. Did you have any negative side effects or feel high or anything like that?
I wish it would make me stop eating. That's what since it don't do that. No, I right now nothing. Nothing. I mean, I'm so, and I took, and this is the thing, and I try to stress to everybody: take notes before you take the stuff. How you feeling right now, and then 2 weeks later, go over those notes and see the difference. That's what I challenge you to do.
Okay. All right. Thank you. Thank you so much for sharing that story. And yeah, that's exactly what we tell our patients to do, is to write it down and track it. All right. So in conclusion, we absolutely need more research. The NFL is doing some research now. The products that they are using are CO2 extracted. So I think we're going to be missing some terpenes and the goodness of the whole plant in that research. And that's what Thrive and Thrive XL are like whole plant formulations. We definitely need more education. Like, we need more CBD. And according to some of this research, maybe we need less THC in athletes. And then, of course, everybody needs access to quality medicine. Okay, I invite you guys to connect with us, follow us on social media at Trusted Canna Nurse. There's my email, there's the website. And then if you feel called, you can use the code THRIVE if you are interested. And with this, here are my references. I don't want to open it up to questions. And I'm going to stop sharing.
Excellent. Yeah, thanks, Megan. Let's see. Yeah, I mean, this was an amazing class. Both your lecture, like, it was perfect. I learned so much, and you really are a master at breaking down complex ideas so that people can understand. And I just want to say, Gilbert, thank you so much for your candid story. It tells us so much about how cannabis works in the body, and you didn't even talk about it scientifically, but we could, as nurses and physicians, we have physicians here, we have tons of nurses here, we could understand exactly what was happening in your body, and the before and after differentiators were amazing. In terms of just like every day, your joints, on your drive, you noticed, hey, my joints aren't swollen, my joints don't hurt. It is amazing how cannabis works in the body, and we're talking CBD here. We're talking about cannabinoids. We're not talking about one molecule that many of our regulators are stuck on, unfortunately, because we're talking about pure medicine that the body knows what to do with. So that's what we're advocating with. So June, go ahead and work that chat.
Okay, our first two questions, basically the same thing, which is great. They want to know, how did you determine the dose, Megan, for your product?
Yeah, great question. So when Gilbert initially started using, what I did was I sent him two of our formulations, our Relief and our Ease. One is high CBD, one is CBG and CBGA. And then he started using those, and he started with a quarter dropper of each twice a day. Start low and go slow. And then he would go up every couple of days. And what ended up working for him was a full dropper of each one. So then that's what we made into Thrive XL, was essentially those two. And then we added CBDA because of the amazing anti-inflammatory properties of CBDA in that formulation. And we changed up the terpene profile because we wanted it to be a little bit more uplifting. People with concussions have enough brain fog and fatigue as it is, so we wanted it to be more uplifting. So that's how we went with the Thrive XL. For people his size, or like my son, who need intensive therapy. And then we also cut that almost in half down to regular Thrive for smaller people or people who need more maintenance dosing. That's kind of how we did that.
It sounds like an amazing product, Megan.
It's wonderful. I love this. The taste is very strong. it is strong taste. So we do send out capsules, you know, like a 10-pack of capsules if people want to try encapsulating it and just swallowing it.
That's great. I love Gilbert's face just now. He went back to the taste. He's like, no, 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 no. But that's just part of what we got to learn to do here is accept the taste of the plant. But it's not for everyone, that's for sure. Someone also wanted to know if you can update us on the legislation of the hemp-derived products in California. I do believe there's been some things going on there recently. Do you know, Megan?
Yes. Bonnie's on. I will give the latest that I know, that it is currently in the health committee right now. I think they're trying to cap it at 0.25 milligrams of THC per dose. We are trying to change that to a ratio. And I'm not sure where, well, I think the health committee is going to take it up. They're like in recess right now or something. So they're going to take it up beginning of August. And then that's when we're going to try to see if we can change it to a ratio. Because yeah, if that goes into effect, then it's almost every single one of our products, including this one, would not be allowed to be sold in California, or would have to go through a dispensary. So, we need to fight that.
Right, right. Great. One question from Lisa. She wants to know about but Lisa, I'll let you ask that if you want to, because I think you're a nurse, right? I want to make sure I get that all correct.
Yeah, not a nurse, but been involved in cannabis education
Right.
and advocacy for years. And I've met Megan at conferences, seen her a number of times. She's fabulous. I'm so glad that she has her product line out and is helping so many more people now on a broader scale. So Megan, you mentioned that your son is not on any CBD right now, but I know there are like former NFL players that won't even let their son play in a flag football league without taking CBD prophylactically, like taking a dose before a practice or a game. So I'd like to get your thoughts on that.
Yeah, I think that that's a great idea. I think if he plays soccer, so it's like risk of head injury is much, I mean, it's still there, but in my mind, it's less than like football, or even like flag football. I think if he was in higher risk sports, I would want him to take, or I would have him take something prophylactically. And I think that's a great idea. I think that people who are actively in contact sports should be taking it prophylactically, although we need research to support that, but that's my opinion. So yeah, I think I think we're going to see that in the future for sure.
So following up on that, your answer might be we need more research, but in terms of taking it prophylactically, do you have any thoughts on whether that's like a daily dose that people take or just before they're going out to be in a situation where there is likely to be contact in a practice or a game?
Right. Great question. That's a hard one to answer because, if somebody doesn't need CBD and they're like perfectly, or they feel like they're perfectly balanced, should we be giving it? But if they're at risk for a head injury, I don't have an answer for that.
So maybe have it on hand. So if there is a bump to the head, they can take it shortly after that happens.
I think that would be my approach with my son. But also if the risk was high and maybe he's like professional or something like that, maybe taking it daily. Also, to help him heal body injuries too would be a good idea. So
Thank you.
Great question though.
Next up is cannabis nurse Wendy. She's asking, you might want to chime in here, Wendy. You mentioned, or was you referring to THCA or CBDA? So I'm not sure what she was referencing there. If she's still there, are you there, Wendy? No.
Oh, I see her. I can answer. It's CBDA that's in the Thrive and the Thrive XL, not THCA. Did I say THCA? I meant CBDA if I did.
Oh, okay.
You had mentioned CBDA and THCA in studies, and that we don't have the studies yet, and that you're looking forward to the studies.
Oh, the acid. Yes. Yeah. And what of those impact inflammatory cytokines. Yes.
Okay, great. And I think Rebecca has a question.
I do. Welcome, Megan. Nice to see you again. And Gilbert, I'm in Appleton, which I put in the chat, just, a stone's throw from Vatican City up there at Lambeau Field. Question I have is, what is the current NFL like protocol for a head injury? Do they even consider CBD as part of their protocol? Is it dependent on the neurologist, or is it dependent on, you know, how are they guiding? How are you getting the information to guide these players?
Yeah, great question. I don't think that CBD is in the protocol. However, they are currently actively researching it. I don't know, Gilbert, do you know anything about their current protocol for head injuries? Or I guess how it's different maybe than when you played?
Oh, it's totally different from when I played, but I think when you get a concussion or something, it's like a week of testing, a week of no contact, a week of being able to adjust. You know, you know, if you get the headaches and the bright lights and all that other stuff, but you have to get cleared. You have to go through the protocol. You have to get cleared by the doctor to be ordered to play in next week's game. But as far as the alphabets y'all be talking about all across the place, no, none of that.
Hopefully we'll see it in the future.
Yeah. So just an update to what we were talking about the legislature. Dr. Goldstein posted that it looks like California has not been moved by the plea to allow access to hemp products with ratios of 15 to 1 or higher for patients. They're leaning towards only allowing CBD isolates to be sold on the hemp market. There's a lobby day in Sacramento for August 5th for those of you who may be living in the California area, in the state of California. So just have to keep after that. And then one person wanted to know, can we order from any state for the Thrive XL?
Yes, we do ship.
Perfect. And let me see if there's anything else there. I think there was one more. Oh, Lynn asked, how do you go about monitoring or recommending consumers who may be using vasodilators such as BP meds, Viagra, etc., and monitoring LFTs before starting and during?
That's a great question, and I think definitely depends on the patient. I'm not concerned about LFTs. Those are like a measure of your liver function. When those are elevated, that's a bad thing. Unless patients are on like really super high doses, like Epidiolex doses, hundreds of milligrams of CBD combined with other medications that can also risk liver injury. And, with vasodilators, I haven't had, there are people who use Thrive and Thrive XL as well as the rest of our products that are also on blood pressure meds and haven't had, that I have heard anyways, any issue with their blood pressure. Of course, we always start low and go slow, a quarter dropper or even a drop at a time, and then slowly go up from there to make sure that there aren't any adverse effects.
Perfect.
Also, in terms of drug-drug interactions, CBD is now on the basic drug-drug interactions. So you can check drug-drug interactions on your own.
Yes.
Yeah.
And
Yeah.
dosing matters with drug-drug interactions. The major risk of interactions, the risk goes up as the dose goes up. I'm not seeing much interaction at the lower doses, 50 milligrams or less. Above that, and if other clinicians want to chime in too, feel free.
Before I forget, I just want to point out that although this is about concussions and you included long COVID and you sort of mentioned other neuroinflammatory brain diseases or syndromes or symptoms, I should really point out that modern living is very stressful on the brain, and our modern food is causing neuroinflammation. So, this doesn't just apply for all cannabinoid medicine. You don't have to pigeonhole it. This is for that, this is only for concussions. This is about brain health, over the long haul too. So I just wanted to point that out. Like, I'm definitely interested in Thrive at this moment. I'm curious about the CBC, and I love CBG. I love, yeah. So I'm definitely curious about the product. And go ahead, June. Sorry.
Next question was in reference to concussions. Is there an amount of time that passes after the concussion so that CBD isn't effective? Like 1 week, a month, even longer?
That's a great question. I don't have an answer to that. I will say at the begin with my son's concussion, the CBD helped with the headache, but he also needed Tylenol and some Motrin at the beginning to help with the headache. But yeah, I don't have an answer for like if there's a point where it becomes ineffective. I would think if you're still getting it, it's still doing something in the brain and the body.
Right, I agree. Someone said that they had also previously heard through one of Dr. Sulak's webinars that CBDA interacts with CBG. And have you seen any interactions between depending on high or low doses of either?
What kind of interaction?
If that person's still on, can you answer that? Because they did not mention that in the question. I don't know.
Carol, you can unmute. Anyone can unmute,
Yeah.
or I can unmute you.
Hi. Yes, if I recall right, I believe that he was saying that CBG prevented the CBDA full benefits from happening. But I remember that he said that it was the timing, so not to take them at the same time. But I want to recall the full spectrum of what he was referencing, and I don't remember. So I was just curious if you had seen interactions when mixing the two cannabinoids together.
Great question. I think I remember seeing that study where they looked at the absorption of CBG and CBDA. I don't have an answer. I mean, ours are obviously mixed in the formulation, and we don't know until we do like the human studies, which is absorbing and not absorbing. So great question. I don't have an answer.
Okay, thank you.
All right, next question is from Ms. Sanchez. She goes, as a massage therapist, how can I go about explaining the benefits to my 2 NFL player clients? Like, do I approach the CBD use with the physical benefits first or preventative benefits?
Or the legal approach, and she's asking that question to Gilbert.
Yeah, yeah.
She said, what? How do you approach them? Tell them. You mean, don't go ahead and tell them. Hey man, I know this dude, and he said this, that, the other. Ain't no sweetener. Just tell them. Say it works. And if they need my number to ask me, just tell me,
That's the best. That's the best
Just
bad
go
right
straight
there.
down the middle. That's the best way to do it.
Yeah.
Perfect.
Love it.
Post this on YouTube, so it'll be a YouTube link that you guys can share if people want to learn the science.
Great. One question here, and I think this goes back to how, possible drug interactions is, Jennifer says that beta blockers seem to have the biggest interactions. And so they tell people if they are using PO-CBD, separate the dose from beta blockers by 2 hours. Would you agree with that?
Yeah, that's about consistent with what we tell people who work with us.
Yeah. Okay.
We have some great comments in the chat from the doctors who are here. Dr. Janessa Wilson-King, Dr. Bonnie Goldstein, and Dr. John Talleyrand. Thank you so much for coming. And we'd love to hear from you if you want to unmute before we end our webinar today. And I just want to thank everyone so much for coming. This has been amazing. So go ahead and if anyone wants to say anything, we'd love to hear from you, our doctors.
Yes, please share any stories or anything.
I'm going to make a comment. Hi, everybody. It's Bonnie Goldstein. I'm not ready for camera, so I'm sorry I can't put that on too early in the morning for me on a Sunday.
Yeah.
I not sure if the person asking the question about the interaction between CBD and CBGA, maybe I'm thinking of something else. There is an article that shows that when you take CBDA with CBD, it blocks one of the transport mechanisms, CBDA does, and that thereby increases the amount of CBD that you retain in your bloodstream. It keeps the presence of CBDA, increases the CBD in the bloodstream by blocking this, like an efflux mechanism. So hopefully that makes sense. And then one other thing I was going to say is I actually treat my concussion patients for a minimum. I tell them 3 to 6 months, just to really provide that extra protection. And many of them are sports avid athletes, and they want to go back. And I always feel like I'd rather have it in their system at a reasonable dose if they're going to have another injury that might come up, whether it is soccer or football or whatever. So I try, and then many of them will tell me too, if they go off of it, they do feel sometimes brain fog or a return of symptoms. So I just encourage them to stay on it because, again, like you said, Megan, it's just neuroprotective and it's going to have some benefit. And then my last comment is in 2014, there was a study, I think it was here at the UCLA Harbor Hospital, where they had people who came in with traumatic brain injuries. And all they did was look at whether or not there was the presence of THC in their urine. So all they did was a urine tox screen. That's it. And then they followed these patients for 3 years after their traumatic brain injury and looked at who died and who didn't die. And the mortality rate in those who had a traumatic brain injury without THC in their system was 11%, which is pretty high. And those who had a traumatic brain injury and had just had a positive tox screen for THC, at 3 years, the mortality rate was 2%. So, and that's statistically significant. So there is some benefit to THC, whether it's a little bit or a lot, we don't know. But having full spectrum CBD is so important because it does contain some THC in there and we cannot ignore it, even though you want those other compounds as well, as Megan mentioned. So thank you.
Thank you, Bonnie.
And thank you, Gilbert, too. Thank you for your advocacy.
I'd like to echo Bonnie's comments about what this is Janesta Wilson King. And thank you all for allowing me to be here and actually say something. Hey, Honey Smith Walls, that is. I'd like to echo what Bonnie said in that I continue treatment of any concussion patient. They can stay on their CBD med for as long as they want to take it. They are people who tend to be quite active if they've gotten a concussion, generally speaking. Now, sometimes there's a freak accident that leads to a concussion, but certainly I would continue the medication for as long as they want to take it. It certainly is a good wellness product also. And most of our lifestyles are not consistent with decreased inflammation in the body. So taking something that's going to help decrease the inflammation in your body overall is quite beneficial. And I would certainly encourage that for sure. And just because you're not feeling anything doesn't mean it's not doing anything. So really, and the other thing I wanted to mention is that with taking any pharmaceutical meds and your cannabis meds 2 hours apart for any of them, then you don't have to even worry about it. Just always take your cannabis 2 hours away from any pharmaceutical, and that can generally cover any risk of drug interaction. So thank you for allowing me to say a little something.
Thank you so much, Dr. Wilson King. Thank you. Amazing. Thank you, Dr. Goldstein. I was thinking firstly about the CBDA, CBD scenario Dr. Goldstein was saying, in a way, you know, the CBDA is acting as a little bit of a turbo booster, if I understand it, for the CBD, because it's keeping the CBD in the body around longer for our bodies to use for a longer period of time. Does that make sense, Megan? Did I understand that correctly?
I think so. I need to go look at that, like back at that study, but based on what Dr. Goldstein was saying, that sounds right.
I'll see if I can find the study and post it. I just posted the THC mortality study for the brain injury.
That was an amazing study too. And also in terms of the CBDA acting as a turbo boost for the CBD, God, I forgot my point, shoot. Just that these, you know, as we know, the cannabinoids work better together, and we, yeah, I'm sorry, I lost my point. I'm so sorry. Dr. Talleyrand, can you unmute? Yay, let's hear from our trifecta of doctors today.
Hi, good morning, everyone. I don't know what you were going to say, but I do have a comment as usual about dosage. You know, pay attention to your dosage. Dosage can be affected by your environment too. What meal you had it with, if you did have it with a meal or not, can affect whether the medicine is working. I look at every product as a different product, so not every CBD is the same because of this unique formulation. You know, dosage for this product could be different than another CBD product. So track it for sure, and you know, be patient, wait it out, you know, take it daily. After a while, you'll get to the right dosage.
Thank you.
Yep, it's a journey. We used to tell our patients that in the dispensary when I worked in Maryland. This is a journey. You know, you're not going to get it right the first time, but the beauty is that we will find something that works for you. I think Harold had his hand up. So, but Megan, I'll make a little funny here. At least I hope you ladies think it's funny. I love the idea. Some of us of a certain age on here that would love to get rid of the brain fog. Concussion or no concussion, we would love to be able to go back to thinking much clearer. So that's wonderful to think that that can help with that also. So Harold, you've been very patient, sir. What would you like to say?
Thank you, Megan. I enjoyed the presentation. Thank you so much. So my question is around the formulation of the drug. On the website, I saw CBD, CBG, CBDA, CBGA, THC is at 27, 23, 4, 5.8, right? So it's a very interesting combination. I'm curious to know, how did you receive this, you know, get to this point of those ratios?
Great question. And, you know, with cannabinoids and plant medicine, you can aim for one thing, but then it will test out as something a couple milligrams, you know, up or down. So what we did, we aimed for something. I said, I want this many and this many and this many of the acids. And then of course the acids run the risk of converting to CBD and CBG. So that's essentially what they tested out at. You know, so I wanted to match the label with what is actually in the product. So I think we aimed for, like, I think it was like 25 of each, 25 of each. I can't remember what we aimed for, but that's what it ended up testing out at. Same thing with the XL. We had this, I think I wanted 50 CBD, 40 CBG, and then 10 of each. And then the way to test it out just came out slightly different.
And the THC is needed as a whole to excite.
Right. The THC in there is natural. The THC and the CBC are naturally occurring.
Okay.
And we see that, you know, products with a small amount of THC work better than those without the THC.
All right. Thank you.
Oh, we had another question pop in. When regard to long COVID patients, can clinicians speak on if they have tried CBG in clinical practice?
We've had some long COVID patients have benefit with CBG and CBD in their symptoms. We are seeing microdosing psilocybin help with long COVID. There's a paper that came out that said long COVID was associated with the serotonin depletion. So we're seeing that, and also the strong anti-inflammatory properties of both cannabis and psilocybin. But if other clinicians are treating long COVID, please chime in. Wheeler?
I was going to mention, and this is different subject. That's why I kind of gave a little pregnant pause there to give somebody else a chance to respond to that. But in reference to the question about the NFL and their current protocol for concussions, it is, as Gilbert was saying, much different than it was in the past. The player is removed immediately from the game, is not allowed to return, and they do assessments on the sideline, and they do have a variety, actually it's a whole battery of tests, neuropsychological baseline tests that they perform, and the player cannot return to action before passing every one of these tests. And there's they evaluate attention, memory, language, visual, spatial reasoning, processing, executive function, all sorts of things. And they gradually, then after passing, they'll gradually reintroduce them to light physical activity, and then it increases from there. But the NFL is, as Gilbert mentioned, being much more intentional about their treatment of concussion these days. So just to let you know about that. And I am a sports nut, so that's how I know that, in case anybody's wondering. I love my Philadelphia Eagles, okay? And I don't know who you played for, Gilbert. Yeah, I see the thumbs down. I hope it wasn't Dallas. Okay, good. Thumbs down to that too, right? Yeah, I got you.
We have a question for Gilbert. Did trying plant medicine for the first time make you want to try others?
No, not at all. I'm doing it for health reasons only. You know, trust me, I got friends that they wake up smoking. You know, that's the first thing they put in their mouth. You know, but and going from that to the gummies and all the other stuff. But for me personally, I'm just doing it to better myself, and hopefully that it helps my mom and a couple other people I love and care about. You know, and if it's doing that, why not tell other people so they can help their families and help themselves? So it'd be stupid to keep it inside. And Megan came up with something good, and I really appreciate she did that.
I love your discipline, Gilbert. It's really inspiring, you know, just across the board.
Yeah, if you got friends like I do, oh my God. They're like, hey, come on, man. You ain't even taking no Nope, can't do it. I'm a chicken. I don't even like to fly, so I'm a chicken.
Got it. I love how, though, a lot of people can't understand that THC has so many other properties. And one of those properties being, you know, to help the other cannabinoids, the non-intoxicating cannabinoids, do a better job in the body. Another thing THC is great for, it's an anti-itch. I've been using it for, I got a sunburn that was super, super itchy. Within seconds, when I put a topical THC on it, a nanoparticle topical THC, gone. Like, THC is a great anti-itch formula. It has so many medicinal properties as well. And that's the beauty of cannabis medicine. We get to pick and choose which properties we want and by the dosing, you know? So go ahead, Adelina.
Hey, okay, I think I got this together now. I just wanted, I wanted to mention to Gilbert, I guess that's why I had asked the question like I did, because I get that reply back, you know, the little goofy, the laughing, no, that's why I smoke, and, you know, like that kind of reaction. And so I've found it, I guess, like difficult to communicate to them, like, this smoke could help you in your career, in your body, in your health. And that's why I was asking, like, how do I approach, what will catch their attention? How do I bring it to their attention?
Well, I mean, these guys are playing now. Are they
One
retired?
is. One
See,
is. I think in Canada.
there's a different mentality with athletes nowadays. I mean, the older version and the newer version, you know, it's a totally the minds are different, you know. One can, you know, but it's how I guess it can be in a way how you can approach them. The older one should be able to get it. The younger one, he's still stuck on the weed part of it, you know. That's what he's stuck on. He's stuck on the weed part of it, and it's just like, hey, stupid, this is going to help you. It's going to help your joints. It's going to help you do this. It's going to help you do that. And the crazy thing about it is, I'm one of those dudes that like to stay up and watch TV late at night. I can't do that no more because I'm asleep. You know, this stuff helps you sleep. So
Resting now.
yeah, it gets. I mean, that's the thing that an athlete has problem with, is because we're not regular. We want to do this, we want to do that, we want to play video games when we really need to be resting our bodies. And this stuff is really, I mean, it's really opening my eyes to a lot of different things, you know. I wish it had, like I say, helped me stop eating chicken. That's what I wanted to do.
Cool.
I think that you have to address their fears, you know, validate their fears, but then address them, that, like, you know, what we're talking about is something that won't get them high, but it's going to help them heal, you know.
Yeah.
And also too, we are the model of cannabis use, right? So the more healthier you are, the more that makes the plant shine. I just want to talk about Mandy's CBD Epsom salt bath bomb. I used it last night. Love it. It's, you know, that's the beauty of cannabis medicine too. There's so many formulations that are going to help your body, but this is a whole body muscle relaxant. So I just really like this product. And Mandy's been saying that she wants, Gilbert, she wants to send over a topical for your mom. So you guys need to connect. That's Mandy from
I'll connect with Megan. I'll get a hold to Megan, and Megan can get that over to Gilbert for me. I've got a really good topical for her hands that she could combine with Megan's, and it would probably be amazing.
Yeah.
And if I could fit in a bathtub, I would like to use the other stuff too.
Well, Gilbert, you can soak your feet. You can do your feet in a little tub. You can easily do it that way for people who don't do that.
Feet? Okay.
Oh my God. Amazing. Yeah.
We'll work on it. We'll work on an extra bathtub for you, Gilbert, in our spare time. We'll make sure we get a tub big enough for you to soak it.
I have to say I added a lot more Epsom salt to it because I'm just such a fan of magnesium for the body, and I think that absorbing magnesium through the body is a great way to supplement magnesium. Yeah. Can you ship to Canada, Megan?
Yes, we do ship to Canada.
And Brianna, thank you so much for being here and all you do in cannabis. We're going to hear from you shortly, but she really appreciates the class, and she always feels holy shit. I always leave feeling like I took something valuable away, and I just want to thank you for that comment, because we've been trying hard here at Cannabis Public School to bring you the content that's educational, entertaining, and definitely move beyond, you know, the inner circle of cannabis to the people who are suffering from carpal tunnel, the people who are having concussions, you know, these everyday life problems. We can help, you know, these products can help. Honey, I loved what you said, healing beyond the high. That's what we need to help people get beyond. But if you like getting high, that's fine too. We're, you know, like I said, that's the beauty of this plant.
Yes.
Yeah. Sunday was a special day. Did it feel like game day? Does it always feel like game day for you, Gilbert? Is Sunday like always game day? Do you always get like some adrenaline?
No, Sunday is sleep-in day. That's what it is. Sleep-in day.
Amen to that. Megan, any last words?
I don't think so. Just make sure you're subscribed. Find a social. You don't have to follow me on all of them because then you'll see me all the time. Find a social, follow me there. We have a great email newsletter list. We have a microdosing program coming up for nurses to do microdosing. And yeah, subscribe to our newsletter on the website. And then again, the discount code is THRIVE for people who want to take advantage. Thank you guys so much for having me. This was amazing.
Thank you. Thank you, Gilbert.
Yes, this was a great day. I mean, look around. You're looking at the warriors
Yeah,
right here, fighting the good fight.
yeah. I agree.
Awesome. Very cool.
Have a great, go out there, have a great rest of your Sunday.
Okay.
Thank
Bye,
you.
guys.
Bye.
Thank you.
Thanks, Megan. This was amazing.
Thank you.
Megan, how you get off of here now? I'm just kidding.
2024, dude. You don't know where the leave button is?
It's called the fax button, you said? What you said? Oh, there it
You're
is.
the-
There it is. There it is.
Thank you, Gilbert.
You're out. Peace.
Oh my God, he was
Awesome.
so amazing. Even my guy's back here, Megan. He listened to this presentation today. He was just so dialed in. He's like, what? What?
Nice.
Yeah.
Great job, Megan. It was such a great combination.
Good. You want to end the recording? Do I do it?